Hi, my name is Sarah Ballard, and this is my presentation on veterinary medical records. Similar to human hospitals, veterinaries use legal medical records to record all the information about a patient when they enter the hospital. So this includes the patient's medical history and signalment. Signalment will be discussed further in the PowerPoint, but medical history consists of any past procedures or surgeries, illnesses or injuries, current and past prescriptions or given supplements, and their activity or behavior. This also includes allergies and reactions to past medications. Next, the medical record should include the presenting complaint or reason for visiting the hospital, as well as anything noted by a doctor during the physical examination. So this might include body condition score, as well as any abnormalities such as lumps or bumps. Next, the record should include at-home observations by the owner. So this is more related to eliminating habits, appetite, behavior at home, etc. And then once the doctor begins working with the patient, they can record any test results found, including lab work and blood work, any potential diagnosis, treatment plan options, and of course the owner's contact information if there's anything that needs to be discussed later. A patient's medical records are updated at each visit and should be made available for the owner to look over, whether it be an electronic copy or a paper copy. Another way of gathering the information needed for a medical record is by using the SOAP acronym. So this consists of the same information listed on the previous slide, just in a different format. So it has subjective information, which is, again, the patient's medical history and presenting complaint. Objective information, which includes anything gathered in a physical examination or test results. Then an assessment made by the doctor, which includes any possible diagnosis, and there may be more than one while the doctor is trying to pinpoint exactly what's going on with the animal and while they're waiting for any test results to come back. And then finally, a plan to treat the patient. So we just discussed the many things that do need to be kept in a medical record, and there's only a few pieces of information that really aren't necessary to keep in the record. So this consists of personal information about the client, such as their appearance or personality. Any impressions, judgments, or opinions that we form about them should be kept out of the medical record as long as it doesn't pertain directly to the animal's health. And then it's also important to remember that although the receptionists and assistants or technicians may work directly with the animal, they're not legally allowed to diagnose a patient with a certain illness or condition, so only the doctor's diagnosis should be kept in the medical record. A patient's signalment is a brief overview of pretty much everything that makes up who the patient is, and it's helpful in giving the doctor a better understanding of what they're walking into when they go to meet a patient. So this includes the patient's name, their age, their species, breed if applicable, mostly to dogs and some cats, the sex of the patient, so male or female, and then their reproduction status, neutered or spayed. So an example of this using my own dog would be Spiky, a 10-year-old male neutered boxer, is waiting in room 4. So if you wanted to take this a step further and include the patient's weight and presenting complaint, using my first example, I would say, Spiky, a 60-pound, 10-year-old male neutered boxer dog, is in to have his incision looked at. So now this includes all the factors of their signalment, and the doctor will know exactly what they're walking into. When writing a medical record, it's inevitable that sometimes mistakes are made, but there are 3 simple steps that can be taken to correct the error. First, you want to cross out the old error with a single line. You want to use a single line because if you were to scribble, then the record can become unorganized pretty quickly, and if there's any reason to go back to the mistake, you want to be able to see it. Next, you put your initials and the date next to the line, and this is so that people can track when changes were made and who made the changes so that everyone has clarity on the situation. Next, you add the correction right next to where the error is. So, following the example I made below, I'm doing a correction on an animal's date of birth, and the line is a little hard to see because it's bright orange, but you can see I crossed out the date, put my initials on top with the date of my correction, and then right below I have 06/08/15 as the correct date of birth. Online medical records help us in reducing errors and increasing patient support by use of CDS systems, CPOE systems, and health information exchange, but there are still both benefits and risks involved. Some of the benefits include quick access to medical records and sharing of data through cloud services, which allows for owners to access their pets' medical records at any time of the day on any device. Additionally, instead of veterinarians needing to fax or send information to each other, it can now be shared online, which reduces the redundancy of testing. Online medical records allow for legible documentation and the reduction of paperwork and storage, as files no longer need to be kept and organized. Lastly, because there is an increased ability to conduct research by keeping all of the relevant information in one place, there is an improvement of productivity and efficiency in the workplace. Some of the risks involved with online medical records include security and privacy factors, adoption, implementation, and maintenance costs, and changes in workflow as everyone gets caught up to date on how the new technology works. Overall, they have allowed for increased patient safety, effectiveness, and efficiency. I hope you enjoyed my presentation on veterinary medical records, and thank you for watching.